Nutrition touches every aspect of medicine.
This work feels like it's a model for other institutions to follow.
Today, we are celebrating the foundation of this institute. I'm so honored to be here. I'm going to be speaking in hopes to make this really the model for the future of healthcare nationwide.
It's inspiring to be here and be a part of the launch and really the planning for the Joan P. Institute for Nutrition Science and Health. It feels like it's one of the most innovative models that's coming out of healthcare today.
The average doctor only gets about 4 hours of nutrition training out of thousands of hours of preclinical instruction. Most of what we see are these lifestyle diseases like heart disease and diabetes and obesity. These are diseases that can be prevented, arrested, and potentially even reversed by treating the underlying cause, the diet and lifestyle that led people to these conditions.
It feels like a new and innovative approach to integrate lifestyle medicine and nutrition across the entire enterprise. What's being done here is to really bring benefit to the community.
It's the first medical center that I'm aware of that has teamed up officially with the American College of Lifestyle Medicine, which is really leading the charge, is to put these lifestyle interventions in place to actually treat disease. And it's so exciting to see this initiative here to finally put patients first and cure what ails us.